The first British field hospital, meanwhile, has been set up in Gaza and is aiming to be fully functioning early next week. The hospital was sent by truck from Manchester to provide life-saving medical treatment for the sick and injured in the Strip. It has been established by a team from the aid organisation UK Med, which deploys many NHS staff to emergencies. It's already has surgical teams working in the Al-Aqsa Hospital, the only hospital still functioning in the centre of the Gaza Strip. From Jerusalem, our senior international correspondent Orla Guerin sent this report.
Wheeled through the chaos, 12-year-old Anas, another young victim of Israel's assault on Gaza. He's on his way to surgery in Al-Aqsa Hospital, a team from UK Med standing by.
So we got the patient with the femoral fracture. He's a very brave boy, so let's go.
Anas says he was playing when his neighbourhood was bombed. He was injured and his mother and 6-month-old baby brother were killed. May God have mercy on their souls, he says. The surgery goes well. It's one of hundreds the team have performed at the hospital, where they've been faced with desperate need and some of the worst that war can do.
I've worked in many war zones over the past 9 years, and I think what shocks me about this particular context is the number of children injured that we are seeing and the extent of those injuries. They are life-changing injuries that the child will have to live with.
With Gaza's hospitals overwhelmed and sometimes under Israeli attack, the UK team have been building a new facility. It's in the desert sands north of Rafah. They got started with local timber from destroyed buildings when their field hospital was held up at the border.
It took a lot of negotiation to get land. It took a lot of negotiation to get things across the border. It's been a challenge to find staff. It's been a challenge to communicate. None of the phones work. None of the internet works. And everything somehow has to be made to work in order to bring essential, urgent, life-saving services to people.
They are already seeing about 100 outpatients a day here and expect to double that soon. The doctors are ready to treat everything from minor illnesses to gunshot wounds. And if Israel carries out a ground invasion of Rafah, as it's threatening to do, this field hospital could be crucial. Orla Guerin, BBC News, Jerusalem.
Well, we just saw David Whitewick in the report, but we spoke with him a little earlier on the programme. He joined us from Rafah, and he started by describing the work that they're doing there.
We've treated over 3,000 patients, and I think you saw from the report that a very large number of them are very seriously injured. I mean, there are simply thousands of amputees, many of them children. We are seeing gunshot wounds. We're seeing historical wounds from months ago, which have been either badly treated or treated very quickly, and people have had to live with the consequences of that. And of course, we're seeing the normal background illnesses that you would see in any population, especially when they're concentrated into a tiny area with very few services. So a lot of chest diseases, a lot of diarrhea, a lot of the stuff that you would expect. It's really quite an acute situation at the moment.
Now, before we leave